Aloha, I'm Dr. Catherine Taketa-Wong. Thank you for joining me today. And today we're going to be talking about hidden allergies and how they could be behind tiredness, digestive problems, headaches, and a lot more. So we'll get into that in more detail later on. But just for those of you who aren't familiar with myself and my background, I'm a naturopathic physician and an acupuncturist. And for those of you who aren't familiar with naturopathic physicians, we're trained as primary care physicians. And as such, I can order lab tests, write prescriptions, do school physicals, just like other doctors. However, a big difference is that naturopathic doctors are trained in using diet, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So before we begin, I just wanted to let you know that if you have any health concerns that you'd like to talk with me about, we do offer a no-charge phone consultation. The 15-minute phone consultation is where we talk about your condition and then come up with a plan to be able to help you the most. Arranging a consultation is very easy. You can call our office at our new number, 808-425-2987, and let our staff know that you're interested in a no-charge phone consultation. So getting started with today's event, how hidden allergies can be behind tiredness, digestive problems, headaches, and more. So we'll be talking about allergies and food sensitivities and their treatment, and how allergies and sensitivities can cause all kinds of health problems aside from just the typical allergy symptoms. So some things that you may want to think about: are you or your family dealing with abdominal pain, constipation or diarrhea, gas or bloating? Are you dealing with headaches, chronic fatigue? Are you having bedwetting issues where either an adult or a child who is beyond the normal age for wetting the bed is still wetting the bed? Autoimmune diseases? Do you have joint pain? Do you have difficulty sleeping? Do you have colds and coughs and illnesses? Like, are you getting sick all the time? Or anxiety or other kinds of things. So even if you don't have the typical allergy symptoms or noticeable digestive symptoms, sometimes the underlying cause can actually be a sensitivity or it could be a low-level allergy. And why is this? Sensitivities can cause more inflammation in the body. And so in that case, the symptoms can manifest in a lot of different ways. And one of the ways that can happen are some of the things that I mentioned, so insomnia and joint pain and many other potential symptoms. And we'll get into that in more detail a little bit later on. But for example, I've had a number of children with ADHD with difficulty with focus and attention, where we find on testing that they actually have food sensitivities. And so some of these children have issues with gluten or dairy or other types of foods. And then we find that when we take those foods out of their diet, that their focus and attention improves. And these are sometimes individuals that don't have the typical type of allergy symptoms, like itchy, red, watery eyes or nose, sneezing, wheezing, skin rashes, but that they did have sensitivities that caused inflammation and made it more difficult for them to focus and pay attention. And so that's just one example of a condition where I will often test people for food allergies or sensitivities. I've had a few other cases of individuals with ADHD where they had none of the typical allergy symptoms. Again, the itchy, red, watery eyes or nose and sneezing, skin rashes, things like that. Didn't have any of that. But when I did extensive testing, then I did find that they did have actual allergies that came up on their test. And I had one individual that came up with a number of different food allergies and didn't have any allergy type of symptoms. And then we found that when he took those foods out of his diet, that he did improve with his focus and attention. So again, that's an example of how allergies or sensitivities could be causing some issues that you wouldn't typically associate with an allergy. So I like to address the difference between allergies and sensitivities because those are things that are commonly misunderstood. So what are allergies and sensitivities? So first I'll talk about allergies. So basically, allergies are when your immune system is attacking something that is not inherently harmful. So our immune system is normally our defense mechanism to protect us against things that can make us sick. So normally our immune system is supposed to attack bacteria or viruses or yeast or fungi, things that can actually make us sick. But in the case of allergies, the immune system, for some reason, is attacking things like foods, for example, peanuts. And if someone has a peanut allergy, then their immune system thinks that the peanut is something that's bad. And so the immune system is attacking it. And then that's what's causing the symptoms. And people can have allergies, of course, to pollens, to certain grasses or trees, to dust mites, to a number of different things. And there's nothing inherently wrong with, say, pollens, but for whatever reason, the immune system is attacking that thing, be it dust or cheese or dog fur or whatever the person is allergic to. And then that's causing the symptoms. So an actual allergy is associated with the typical type of symptoms that we usually think of when we hear the word allergy. So the typical symptoms are, for example, itchy, red, watery eyes, sneezing. Someone can have skin rashes or hives. Also, people might have diarrhea or abdominal pain. Some people, if they have really bad allergies, it might go to their lungs and then they start wheezing. Like it could trigger asthma. And then if people have a very severe allergic reaction, then it could actually be life-threatening, what's called an anaphylactic reaction. And in that case, what's happening is that their tongue may swell up, their throat may swell up, and it may swell up to the point that they can't breathe, where it blocks off their trachea, which is the tube that connects your nose and your lungs. And also, people can start to have a reaction inside of their lungs where they have difficulty breathing. And in really severe cases, it can also affect the heart and other types of things. And so that's why people who have really severe allergies will carry things like EpiPens to address those really severe types of allergies. So the difference with a sensitivity is that the sensitivities, the symptoms for those are typically much more vague and much more general. So for example, like I mentioned, some of the other types of things that can happen when someone has a sensitivity, that they may get some of the typical types of allergy symptoms, like they may get abdominal pain or diarrhea, or they may get skin rashes. But things like eczema, I more commonly see with food sensitivities. And then people can also have a number of different symptoms based on where the inflammation is in their body with a sensitivity. So again, a sensitivity can cause a number of different types of symptoms. So I've seen it cause not only digestive symptoms, for example, like diarrhea or constipation, but I've also seen food sensitivities cause headaches, migraines. I've seen them make people tired all the time. I've seen it be a contributing factor to autoimmune conditions where the immune system is attacking the person's own body. So I've seen some autoimmune conditions where if people have sensitivities to certain foods and they take those out of their diet, that they then are able to have better quality of life, fewer of the autoimmune symptoms, where it doesn't tend to be as severe, it doesn't tend to flare up as much. I've also seen people have joint pain. I've seen people who have anxiety or depression, people who have insomnia, or people who are just sick all the time. They're constantly getting colds and flu, and they're just sick all the time. And so those are just some of the things that I'll consider for food sensitivities. Another difference between allergies and sensitivities is the way that the body is responding. So in allergies, the body is making something called an antibody or a protein that they use to attack that particular thing the person is allergic to. And so in an allergy, the body is making an antibody called IgE. And in a food sensitivity, then the body is making a different type of antibody, which is called IgG. And these are two completely different proteins. They're two completely separate antibodies. And so that's why in some cases I will test for both allergies and sensitivities, because since they are two separate antibodies or two separate proteins, then it's possible that you may have foods that come up on one and not the other, or vice versa. So you can have, say, an egg allergy, and you may not have egg that shows up on an IgG food panel. But for example, you might have gluten that comes up, or wheat that comes up on an IgG panel, but not on the allergy IgE panel. So you just have to keep in mind again that those are two different things. And I have a number of people who come in and they say, you know, my doctor tested me for allergies, nothing came up on the panel, so there's no foods that I have to avoid. And I have to explain to them the difference between allergies and sensitivities. And I say, well, that's good that your doctor checked you for allergies. And that helps to say, okay, well, maybe you don't have an allergy to these foods, but you may have a sensitivity. And that's a separate test. And so just keeping that in mind. There is another way that people can have a sensitivity. And sensitivities are primarily with foods. Sometimes people can have sensitivities to other kinds of things, for example, like certain chemicals that cause a rash, where it's not an actual allergy, but they're sensitive to it, or certain perfumes or dyes might cause rashes. That's another sensitivity. But primarily, most of the sensitivities that I work with are with food. So like I mentioned, the body can make something that's called IgG, and that's one way that you can have a sensitivity. That's where your body is trying to attack those foods that you're sensitive to. But another way is that a person may have difficulty with making the enzymes that they need to break down certain foods. And a common example that most people are familiar with of a sensitivity like that is lactose intolerance. And so lactose intolerance technically is not really an allergy, even though a lot of people say, oh, I'm allergic to milk. It is possible for somebody to have lactose intolerance and not come up positive on a milk allergy test. So lactose intolerance is where someone has difficulty breaking down lactose, which is the milk sugar. And the enzyme that breaks down lactose is called lactase. And so our body needs to be able to make lactase in order to break down lactose. But there are a number of people who don't make the enzyme lactase, or they don't make enough of it to adequately be able to break down lactose. And so what happens is when they ingest lactose or dairy foods, for example, milk, cheese, ice cream, things like that, then they might get upset stomach, they could get diarrhea, they could get really bloated. And so those are symptoms where, for example, someone has a lactose intolerance, where it's a sensitivity. And in that case, again, they don't have the enzyme to break down that food. Now, people can also have sensitivities to other foods besides just lactose. So there are a number of other foods that people may not be making enough digestive enzymes for. For example, some people might have a really hard time digesting fats. So any kind of oil or fat, be it olive oil or butter or fatty foods with a lot of grease. Sometimes people aren't making enough of the digestive enzyme to break down certain fats. Or sometimes it could be enzymes that break down other foods. So there are some tests available for some of those. And that's another way that someone can have a sensitivity. So just remember the take-home message. I know I went through a lot of details with that, but the main idea to remember is that if your doctor tested you for allergies and said, oh, you have no allergies, just remember that that is not the only way that you could have a problem with certain foods, and that you may potentially have a sensitivity with a food. And that requires, like I said, additional testing. And there can be, in terms of the case where people don't have enough of the enzyme to break down a food, there are sometimes supplements where digestive enzymes are in a supplement, and some people can take that and it can help them to be able to digest and break down the food. There are other people who really need to just avoid the food, where they have much better results if they just take that food out of their diet rather than trying to take the enzyme. But it does depend on the person. So some of the other things that I'm going to talk about is that there are natural ways to be able to treat both allergies and sensitivities. So with testing is really the first step for both allergies and sensitivities. So once we know what a person is allergic to, then we can help to address that. So for example, I might test someone for both allergies and sensitivities, and also depending on the symptoms that they're having, I might check for other things as well. But there are natural types of allergy treatments. So one thing, for example, is an herb called nettles. And nettles, it acts like a natural antihistamine. So people may be familiar with a class of drugs that are called antihistamines. And of course, with antihistamines, what they're doing is they're helping to decrease histamine. So when someone has an allergy, what's happening is that their body's making too much of a compound called histamine. And histamine is what causes the typical types of allergy symptoms with itchy, red, watery eyes, hives. Someone might have wheezing or diarrhea or upset stomach. Someone also might have anaphylactic reactions, like I mentioned, where their tongue or their throat swells up. And so antihistamine is something that will help to decrease the histamine levels in the body. So a really common antihistamine that most people know about is Benadryl. But there, like I said, are natural antihistamines. So nettles, like I said, is an herb that is a natural type of antihistamine. So another treatment that I use is a compound that's called quercetin, and that's spelled Quercetin. And quercetin is a compound that's naturally found in foods like onions, garlic, apples, and other foods. But quercetin is also another natural antihistamine that can be helpful. So there are, like I said, natural antihistamines that are available, but I really like to try to figure out the underlying issue and be able to treat that. So one thing that many people don't realize is that for both allergies and sensitivities, that the gut is really important to that, and that the gut is really linked into the immune system. So what's really interesting is that research has found that the cells in our immune system actually communicate with our good gut bacteria. So most people have heard that there's good bacteria in our gut and things like lactobacillus that are important for us. And most people think about probiotics, or those good bacteria, as being good for your digestion. But one thing that many people don't realize is that probiotics and good gut bacteria is actually really important for your immune system to function normally as well. So, for example, some of the things that you can have in terms of having the gut and immune system connection is that if the gut is inflamed, if there's inflammation going on in the gut, then that can cause problems in the immune system. So like I said, the good bacteria in the gut and our immune system cells will actually talk with each other. And they found that the good gut bacteria are actually very important to having a normally functioning immune system. And so if you, for example, take antibiotics that kill off the bad bacteria, but they also kill the good bacteria, then you don't have the good bacteria that are supposed to talk to the immune system and keep the immune system balanced. And so if the gut is out of balance and it's causing problems with the immune system, then that can be one risk factor for allergies. So it's pretty interesting because they found that, for example, people who have more inflammation in their gut may be more prone to allergies. Another thing that's really interesting is that when babies are born through the vaginal canal, that's a really important way for helping to start the good gut bacteria in their gut. So when a baby goes through the vaginal canal, then the baby gets the mother's good vaginal flora, the good bacteria on their skin as they come out through the vagina. And then baby then puts their hands in their mouth, and then that starts the growth of the good bacteria in the gut. And when a baby is born by C-section, they aren't exposed to the same kinds of good gut bacteria. And what's interesting is that research has found that babies that are born by C-section have a different type of gut flora. They have different types of good bacteria in their gut than a baby who's born by a vaginal birth. And another interesting thing is that some studies have found that babies who are born by C-section have a higher incidence of allergies and asthma. And one theory is that if the babies born by C-section are not getting enough of those good bacteria to help start their gut, then their immune system from the beginning can be kind of out of balance. And that can be a risk factor for things like allergies and asthma. So it's really important to have our gut be balanced in order to treat the immune system. So I will often look at things like probiotics to help address allergies. And I had one patient where she had pretty bad allergies and she started taking probiotics, and then her allergies just totally went away. That's the only patient that I've had it happen with. And I mean, I would say that most patients with allergies, when they take probiotics, it can over time help with their allergy symptoms, but I haven't had any patients where their allergies, other than that one, where their allergies just completely went away. I wish it was that easy with everyone, but I did have that happen with one patient. And so in that case, you can see how the gut was really connected and with the immune system. And oftentimes, like I said, if we do things to try to help balance out the gut and correct the gut, then we often see improvements in their allergies. So another thing is that there are some ways to help desensitize a person from their allergies. So one way that's commonly known is allergy shots. So with allergy shots, a very tiny, tiny, tiny amount of whatever it is they're allergic to, like a microscopic amount, is put into a shot. And so, for example, someone is allergic to peanuts, and they put tiny, 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 tiny amounts of peanut protein into the shot. And as we expose the body in tiny amounts to the allergens, in theory, it's not supposed to cause an allergic reaction. And as the person is able to tolerate that amount, then over time, the concentration of the allergen is increased. And it's a way of trying to desensitize the immune system to it. One thing that I will often do is that I'll also do sublingual immunotherapy, which is the same idea as allergy shots. It's just that it's available in a dropper, in a liquid that you can take under the tongue. And I find that that is generally better tolerated because sometimes when people have allergy shots, they will sometimes have reactions to the allergen. And I find that the sublingual immunotherapy, the drops under the tongue, are a gentler way. It's generally better tolerated and doesn't typically provoke allergy reactions as severe as with shots. And it's also a gentler way to desensitize people from their allergies. It can sometimes take longer, though. We have about a few more minutes left, so just to let you know, we'll be wrapping up soon. And I just wanted to remind you that we, again, do offer a no-charge phone consultation. So if you'd like to talk with me personally about any health concerns you may have, arranging a phone consultation is very easy. Just call our office at 808-425-2987 and just let our staff know that you're interested in a no-charge phone consultation. There are other things that I do to help to balance the gut and the immune system. Another thing that I look at is vitamin D. So vitamin D is very important to the normal functioning of our immune system. So people think about vitamin D in terms of its relationship to calcium, but most people don't realize that vitamin D is very important for our immune system. And that if you tend to be low in vitamin D, you can be at an increased risk for allergies as well as sensitivities. And sometimes when people have a vitamin D imbalance, if they have too low levels of vitamin D, then they could also be susceptible to having more infections and getting sick more frequently. Because vitamin D helps to keep your immune system in balance. And you don't want your immune system to be one way or the other. You don't want the immune system to be too weak, where in that case it's not attacking the things it's supposed to attack, like bacteria and viruses, and then you get sick all the time. But you also don't want your immune system to be attacking the wrong kind of things. You don't want your immune system to be attacking allergies, for example, to be attacking pollens or dust mites or the food, whatever it is you're allergic to. So vitamin D is something that's really important to keep the body and the immune system in balance so that the immune system isn't too weak and it's also not attacking the wrong things. And another thing for vitamin D is that the blood levels of vitamin D are really important to make sure you're getting enough vitamin D. So the conventional normal reference range for vitamin D is usually somewhere of 20 or 30 to 100 nanograms per mil. But in research, it's found that ideal levels or optimal levels of vitamin D is really closer to about 50 to 80 nanograms per mil. So I will often tell people if they have another doctor that order their vitamin D levels, to always ask for a copy of their actual vitamin D test results. Because I have a number of patients who go in and they get tested from the doctor and the doctor says, oh, your vitamin D is fine. And then I request the test results and then I see, oh, this person had a level of like 25. And if their lab had a range of 20 to 100, then they think, oh, that's fine. But it's 25 is way below optimal. And we really want to see it closer to about 50 to 80. So that's why I always like to look at the actual lab results, or oftentimes I'll order vitamin D levels myself to be checked with patients, because that's really important. And so again, the vitamin D is another thing. And vitamin D, we naturally get that from the sun. You do need to balance that risk with risk of skin cancer. So if possible, if you can go in the sun without getting sunburned, then that's good to get a little bit more sun exposure. If you're the type of person that tends to burn easily, then you probably should still wear sunscreen, and we may just have to supplement with vitamin D. Another thing that I use to help regulate or balance the immune system is probiotics. So for example, I've seen some people where they get antibiotics, it kills off the bad bacteria, but it also kills off the good bacteria. And if they're not eating fermented foods, or if they're not taking probiotics, then for example, they could start to get more allergies, or they could start to get more illnesses because the good bacteria is killed off. And so they're more at risk for developing allergies, or they're more at risk for developing illnesses or colds. And so probiotics and sometimes fermented foods are important to look at that. Another thing that many people with allergies haven't heard of or don't know about is something called a low histamine diet. So as I mentioned earlier, histamines are a compound that's made in our body that if there's too much histamine in the body, then you can get the itchy, watery eyes and itchy, watery red nose, sneezing, wheezing, hives, those kinds of things. But sometimes a histamine intolerance, people have difficulty with breaking down histamines. It can also cause other types of things like histamines. If your body has difficulty breaking it down, can sometimes also cause headaches or insomnia. Can also be a contributing factor to dizziness, to anxiety, digestive symptoms, a number of other things. And so some things to look at are potentially doing what's called a low histamine diet. And so there are certain foods which are naturally high in histamines. And this does not include foods that you're allergic to. So even if you're not allergic to these foods, you may benefit from doing a low histamine diet, because if you have too much histamine in your body already, if you can take out foods that contain histamines or that cause your body to make more histamines, then that can sometimes help your allergies go down. So some of the high histamine foods, for example, are alcoholic beverages, and also there are certain fermented foods, or just fermented foods which can be high in histamines. So sauerkraut vinegar, soy sauce, kefir, yogurt, kombucha. That's if someone has high levels of histamine in their body. Certain cured meats or certain dried fruits, aged cheeses. There are certain types of vegetables or other kinds of foods that are also high in histamine. So you can just look up a low histamine diet. There's definitely information available online about that. But that's another thing, that you may benefit if you have really bad allergies from doing a low histamine diet, even again if you're not allergic to any of the high histamine foods. And one thing that I like to point out to people is that our body always does things for a reason. So sometimes one has to be a medical detective to really figure it out. And so if you or your family member are suffering from unexplained ills, a hidden allergy or sensitivity may be the reason. And there could be other reasons too. So if you feel like you're not satisfied with conventional medicine or what your conventional medical doctor is telling you, then certainly look into some of these hidden types of things. And again, hidden allergies and sensitivities could certainly be an underlying cause. So I suggest working with a naturopathic doctor or holistic doctor who understands the connections between food, the gut, and the immune system, and those kinds of unexplained symptoms. And of course, I'd be happy to talk with you about it. That's why I offer no-charge phone consultations. So thank you for being here. I appreciate the opportunity to let you know about hidden allergies and how they could be affecting your well-being. So if you'd like to arrange a personal no-charge phone consultation, it's easy. Again, just call our office at 808-425-2987, and you'll also find the information on our Facebook page. Mahalo, and see you in 2 weeks. Aloha.